Phil Pine tonight, I want you to take what's on your heart, share where you're seeing, and as we continue this fight for what is right.
Well, I want to thank the gentleman. I want to thank you for organizing this. I want to thank you for bringing this to light. This is something that I know you're obviously very passionate about, and that you have worked on for a long time, many years, and you know, it's not just you. You're obviously a leader here, but also Representative Scott, who spoke earlier, Representative Losbach. You know, I may be the only pharmacist in Congress, but we have many friends of pharmacy in Congress, and we appreciate this very much. But even more so, if I may, even more so, what you're concerned about, what Representative Scott's concerned about, what Representative Losbach, what everyone up here is concerned about is care.
Exactly.
That's what we're talking about.
You've hit it. And just what you're saying about friends, every time we do this, we gain members who begin to look at the issue. They don't just believe what the PBMs bring to them and say, here, look at it. We're getting to the heart of it. All I'm asking, and for me, and I know for you, is for every member here, go talk to a community pharmacist. All they got to do is go talk to them. We're not sharing anything. It's not real.
And that's the whole key. The whole key is that what we're talking about is patient care. We're not talking about somebody trying to community pharmacies trying to pad their pockets, but what we're trying to point out, and what you've done so efficiently, particularly with your chart, is to point out what is happening here. Everyone's concerned about high drug prices right now, and it's one of the biggest subjects that we hear about in the newscasts and everywhere. Granted, this is not the only part of that, but it's a big part of it, because what's happening is we're taking competition out of health care. If we talk about Obamacare, if we talk about the Affordable Care Act, Obamacare, whatever you want to call it, my number one concern with it has taken competition, it has taken the free market out of health care. I mean, think about it. Am I talking just about independent retail pharmacies? No. I'm talking about independent health care. How many independent doctors do you know anymore? No. Most of them are members of healthcare systems. Most of them are members of hospital systems, which are fine systems. But again, we're taking away competition, and that's what's happening here. But Representative Collins, I want to thank you. I want to thank you for again, organizing this and bringing this to light. As you have mentioned, I have been a community pharmacist for over 30 years. Graduated from the University of Georgia in 1980. Go Dogs. Well, just as proud as I can be of my alma mater. And you know, pharmacy has changed tremendously since I graduated. I serve on the advisory board at the University of Georgia and the College of Pharmacy, and I can tell you the quality of students that are graduating now from pharmacy school is just tremendous. The clinical expertise that they are graduating with, it makes us all in healthcare very, very proud. And I still maintain that pharmacists are some of the most overtrained and underutilized professionals out there. But again, I want to get back in full disclosure here. Now, I am a free market person. I am someone who believes in the free market. I believe in competition. And that's all community pharmacists are saying. Let us compete. But as Representative Collins has pointed out so succinctly here, we don't even have the opportunity to compete. Folks, when you have the insurance company owning the pharmacy and making decisions that impact patients and where they can go, and telling patients, no, you cannot buy your prescription over here, you have to buy it over here. That takes the free market out of the system. That takes competition out of the system. Who cannot see that? There are chains out there who will tell you that their operation is a three-legged stool, that they have the PBMs, they have the pharmacy, and now they have their health clinics. Well, what does that do? You know, I mean, it's a great business model, sure. But once they get you, they got you. Because if you go to a pharmacy and they write that prescription, and then that prescription is filled right there, well, obviously that is a conflict of interest. But that's what's happening now. If the insurance company owns them, and tells you you have to go to this pharmacy, that is a problem. True story. True story. Now, my wife, I owned 3 community pharmacies before I became a member of Congress. My wife owns them now. While I still own those pharmacies, I filled a prescription for my wife at the pharmacy that I own. This is about 3 or 4 years ago. Later on that night, she got a call from the insurance company encouraging her to get that prescription filled at another pharmacy. Now, I'm telling you, this is true. I'm honest. That is just crazy.
And yet, if you had done that, they'd have cut your contract off.
Well, exactly.
You know,
Exactly.
you can't engage in that kind of practice. It's amazing.
Well, but it begs the question, how did they know about it?
Exactly.
Okay, how did they know about it? Here's how they know about it. Here's what happens. When you bring a prescription into a pharmacy, we fill that prescription and we adjudicate the claim. What that means is the community pharmacy's computer calls the insurance company's computer, and it tells you automatically whether they're going to pay it and how much they're going to pay. Well, guess what? That pharmacy that owns that insurance company that I just called, they have that information. Yeah, there are laws against it. There's supposed to be a wall there in between them. But you tell me how that pharmacy knew that my wife had a prescription filled that day at the community pharmacy that I owned at that time. Obviously, that's what's happening. You know, Representative Collins, you have introduced a bill, a great bill. It has to do with MAC transparency. MAC, maximum allowable cost. Let me tell you very quickly what maximum allowable cost is. And if we talk about acronyms, well, nobody uses as many acronyms as the federal government uses. And I tell people all the time that one of my goals in Congress is to learn at least 10% of all the acronyms that we use up here. But the acronym MAC, M-A-C, maximum allowable cost, what that is that insurance companies come up with a list and they say, this is what we are going to pay you. This is a maximum we're going to pay you. If you can't buy it any cheaper than that, then I'm sorry, you're just going to lose money. Well, that's okay to a certain extent. We understand that. We can work within that. But what happens is they don't update it. So all of a sudden, and you've seen it, we've all experienced what has happened with the spikes in insurance in drug costs here recently, particularly in generic drugs. What happens is that drug goes up. Well, the insurance company drags their feet and they don't increase that maximum allowable cost, and all of a sudden the pharmacy is dispensing something at a loss. Well, that's obviously a business model that's not going to sustain. You're not going to be able to stay in business if you're dispensing something and losing money on it. And then how do they come up with this MAC list? What we're talking about here and what Representative Collins' bill addresses is what's called MAC transparency. And all we're asking here is to shine light on this, is to have some transparency so we can see exactly what is going on. And that's what his bill does, and we appreciate his work on that very much. His bill is a step forward, not only for the industry, but, again, for the beneficiary, for the patient. That's ultimately who is going to save money. And that's ultimately what we're trying to do here. It's no surprise that costs are going up because of a lack of transparency in the system. No surprise at all. We've got to have more transparency, particularly in the pricing of generics, if we're going to be able to create a stable and an affordable health care system. Now, you heard mentioned here earlier DIR fees. DIR, direct and indirect remuneration. And you heard mentioned clawbacks. Now, let me try to articulate this the best I can. And what happens here is these DIR fees, which is something that's come up in the past probably year, maybe year and a half or 2 years. But what this is I mentioned earlier that when the community pharmacy fills the prescription, that we adjudicate the claim, that our computer calls their computer and the